and welcome to our show Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Made up of the glands that produce hormones, the endocrine system regulates almost everything that happens in the body, controlling growth, puberty, processing food and water, and maintaining the proper levels of blood sugar. The pituitary gland is the master gland controlling all the hormones in the body. Now, if the gland goes wrong, then people can suffer with a range of symptoms and conditions. Pituitary disorders are the most unseen disorders where people struggle with in daily life. We have eminent endocrinologists to provide medically accurate advice on preventing various endocrine conditions related to pituitary gland and help viewers identify long-term control strategies. Today we're joined by Dr. Chitra S, Associate Professor Endocrinology, MS Ramaya Medical College, Bengaluru, Dr. Tejaswi V, Consultant Endocrinologist and Diabetologist, Kaveri Hospital, Bengaluru, and Dr. Himanshu Sharma, Consultant Adult and Pediatric Endocrinologist, Kaushik Arogyam Endocrinology and Women's Health Clinic, Delhi. Thank you so much, doctors, for joining us on the program today. And Dr. Chitra, I'd like to start with you. What is the pituitary gland, if you could explain to our viewers, and what are the component parts of the pituitary glands?
Thank you for that introduction. And the pituitary gland is an extremely important, very small size. It's the size of a pea, it weighs less than a gram, and is found hanging down from the base of our tail. So why should it be close to the brain? Primarily because there is a part of the brain just above this gland called the hypothalamus, which is actually a part of the brain which sends signals to this important gland, which then coordinates numerous activities in the body. So in a newborn child, it is regulating growth, brain development, it's secreting many hormones which in turn lead to maintaining normal blood pressure, pulse, all the regular cycles, reproduction, all the changes which happen during puberty, and also metabolism, whether you're storing fat, whether you're burning fat, all of those functions are primarily controlled by pituitary by mediating it to all the other endocrine glands in the body. So it secretes these hormones which get released into the blood, and they go to distant organs and affect all of these actions. There are essentially two parts to the pituitary, anterior pituitary and posterior pituitary, and the anterior pituitary controls important endocrine organs like the thyroid gland. So the signal has to come from the pituitary for your thyroid gland to function. It also controls the adrenal gland, another important gland which maintains blood pressure, and it also controls your cycles and numerous hormones which could also regulate breastfeeding, for instance. The posterior pituitary is in fact just an outpouching of the brain. Outpouching is the brain forms one fold extra and that blossoms into the posterior pituitary. It secretes two important hormones, one very crucial for liver, and the other which controls the amount of thirst that you feel. So you can see it's extremely small but extremely important for all body functions. And so all of them are continuously talking to each other. And it's a beautiful system which makes sure that we're feeling stable all the time.
All right, Dr. Sharma, if you could tell us, the pituitary gland is called the master gland. So what are the names and the most important hormones secreted by the gland?
Yeah. So basically what happens, that pituitary gland is right below our brain, right? So it releases the messenger that actually controls every other endocrine gland in the body. Right? These messengers are what are called as the pituitary hormones. So the first and the foremost, the role starts right from our birth. The growth that occurs in our body occurs from a pituitary hormone that is known as a growth hormone. Right? Our reproductive functions, such as these are controlled by the FSH energy, that is the follicular stimulating hormone, and the luteinizing hormone that controls our ovaries and testes. Similarly, the adrenal, the stress hormone that the adrenal releases, cortisol, is under control from the adrenocorticotropin hormone, that is the ACTH, to control the cortisol secretion during our stress levels. Similarly, posterior pituitary also releases hormones such as prolactin, which stimulates the breast milk production, and oxytocin that helps in delivery. The most common hormone that every one of us know, it is the TSH hormone. The TSH actually stimulates your thyroid gland and causes the release of the thyroid hormone, which causes changes the metabolism in our body.
All right, Dr. Tejaswi, now if you could tell us, let's get into the problems and your challenges. How common are pituitary tumors and who is most likely to get a pituitary tumor?
So, prevalence of the pituitary tumor is around 115 cases per 1 lakh population, and pituitary tumors is one of the commonest cause of the brain tumors, accounts approximately 15% of all the brain tumors. But clinically active pituitary adenomas that require surgical treatment are rarer. The prevalence increases as the age increases. It's most commonly seen in the middle age group between the 3rd and the 6th decade. But in certain genetic conditions like MEN1, AAP mutation or Carney's complex, it can present early. The incidence of the tumor is similar in both sexes, but it is diagnosed early in the females compared to the males as they present early with the symptoms.
Right. Dr. Sharma, if you could tell us, how does a tumor in the pituitary gland cause abnormal growth elsewhere?
So, when there is a tumor in the pituitary gland, there can be an increased production of the growth hormone, right? Now, this growth hormone actually causes growth of every part of our body. So, that is how a child grows. But when a tumor is there is unregulated secretion of this growth hormone, and it can lead to conversion of the pre-malignant lesions to cause a growth. So like we can get a colonic polyp that can lead to a colonic cancer also. So these growth can cause a excess of growth hormone leads to acromegaly. Now this condition is associated with many other growths in the body.
All right. Dr. Chitra, if you could tell us what causes a pituitary tumor or adenoma to develop. Is a pituitary tumor a brain tumor?
Okay, so a pituitary tumor, although it does occur in the skull, is not a brain tumor. It is a tumor of the gland, which is pituitary itself. And usually brain tumors, people do get very, very scared, but pituitary tumors are usually benign, meaning we tend to do very well if we manage to treat it quite quickly. Most pituitary tumors, why do they occur? The reason is not quite known. It is more a sporadic or a chance event. Like it was highlighted, some of us could have some genetic predisposition which can increase our odds of tumors. But apart from that, for the rest of us, maybe for the 80% of us, it is a chance event. And because the pituitary is such a small gland, which is placed in a nice little bony section inside the bone, and enlargement in this area usually presents as, let's say, headaches. Sometimes there is a nerve there which carries signals from your eyes, so it could affect your vision. Usually the classical symptom is that you're not able to see the sides of your vision, but you're able to see the center. Usually there could be vomiting. Sometimes there could be features which could be because of reduced all the hormones which are produced by the pituitary. That can manifest as just that periods aren't happening in women, or the fact that they are not able to breastfeed a child right after delivery, or that their blood pressures are usually low, or some other electrolytes like sodium and potassium could be abnormal in their bodies.
All right, Dr. Tejaswi, is a pituitary tumor cancer? What is the best treatment for such a tumor?
Okay. So, generally the tumors can be divided into benign and malignant. Benign are those restricted to the local growth, and malignant that have a potential for the distant spread. So, thankfully, most of the pituitary tumors are benign. And although aggressive local growth can occur in some of the condition, prevalence of the malignant pituitary tumor is less than 0.2% of the pituitary tumors. And treatment of pituitary, coming to the second question, the treatment of the pituitary tumors. Treatment of pituitary tumor depends upon the functionality and the mass effects around the surrounding area structures. Functionally, it can be divided into functional and non-functional. Functionals are those tumors which produce excess of pituitary hormones that affect the body, and the choice of treatment for this is surgery, and the choice of surgery is transsphenoidal, where the procedure is done through the nose and the sphenoid sinus to remove the pituitary, except in prolactinoma cases which are due to the autonomous prolactin secretion, which can be treated medically. Coming to the indication of non-functional pituitary adenoma, usually treatment is done for the macroadenoma, that is size more than 1 centimeter with pressure effects causing hypopituitarism, and the tumors which cause visual compromise.
All right. Dr. Chitra, can a pituitary tumor be treated with medication, and how safe is it to undergo surgery?
Right. So one particular type of pituitary tumor responds magically to medications. And usually an endocrinologist should be able to identify if the pituitary tumor which is there in that area is due to a prolactinoma or not. Prolactinoma is the hormone which will melt away literally with medications. So this is the same hormone which is responsible for breastfeeding. So if there is a tumor which is producing excessive prolactin, the usual features with which the person will present will be the fact that their periods are irregular and they have noticed discharge from their breast which is usually milky or at least whitish. This is very common in women, but in men we might not have these manifestations. They are likely to present with, let us say, headaches. They are likely to present with erectile dysfunction or loss of libido. A very simple blood test is all that is required to identify this condition, and a medication which can be given just twice a week, but for a duration which is to about 1 to 3 years, can actually make the pituitary tumor completely disappear. So that is something to know. So don't lose heart, speak to an endocrinologist, figure out what kind of a pituitary tumor is it, and then get the right treatment. The second question about whether pituitary surgeries are safe, the answer to that Dr. Tejaswi has given us already. You might think that the pituitary gland is inside the brain. Does that mean this is a surgery which we go inside the brain? But the position of the pituitary gland is right here, just between your eyes, right? Just above your nose, above the nose. So the access to do the pituitary surgery is not mostly through the skull, it's from the nose. So we call it transnasal transsphenoidal surgery. So the roof of the nose is covered by a very thin plate of bone, which can be knocked out very easily with a small surgical instrument. So right after you go through that sphenoid sinus, you reach the floor of the pituitary gland. So the surgery is now done endoscopically with very minimal invasive surgery, which means that you should be able to be up and about the next day after the surgery and mostly be able to come back home in about 3 to 4 days after the surgery. There are certain other caveats. Because the pituitary gland is such a powerful endocrine gland, there is a requirement for us to make sure that we keep assessing all the hormones which are secreted by the pituitary gland immediately after surgery and even periodically for the rest of our lives. Some people after surgeries might develop some deficiencies related to these hormones, and we might be on certain medications which are life-saving actually. But they're mostly usually tablets and very rarely injections, which can be taken and the patient can absolutely live a well life. So if there is a pituitary tumor, are pituitary surgery safe? They're absolutely safe.
All right. Well, with that, we'll slip into a short break. We have more questions for the doctor, so do stay with us. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we're talking about hormone health. Before the break, we were talking about an operation or surgery to remove the pituitary, a tumor on the pituitary gland. Dr. Sharma, if you could tell us, what is the recovery process then after a pituitary tumor surgery?
So basically, as everybody has discussed, it is now very small and an endoscopic surgery, right? So the patient is able to be shifted from ICU to the bed around the next day, and we are able to discharge him within the next 4 to 5 days. But the patient may have some hormone abnormalities that they develop right after this. So they need to be followed up for at least a month, and there needs to be a time for around 2 to 6 weeks off to resume your normal activities and especially lifting of heavy weights and other things needs to be restrained. So you need to explain for the major any physical exertion that needs to be there, and the follow-up needs to be about the hormones, right? Because we have removed the pituitary, which is the master gland. There can be a decrease in the other hormones that were present. Those need to be continuously followed up, and the proper hormonal replacement needs to be given for these hormones. This is very easy, and most of them are now available as oral pills. The regular follow-up allows us to maintain the treat and the deficiency of these symptoms, so the patients can live a very normal life.
All right, Dr. Tejaswi, can the pituitary gland affect cholesterol, and can the pituitary problems also cause weight gain?
Yes, ma'am. It plays an important role in the metabolism of the lipid. So it is more evident in case of deficiency of hormones, certain pituitary hormones like growth hormone, TSH, and gonadotropin, which results in increase in total cholesterol, triglycerides, and LDL, and it also decreases the HDL, which in turn affect the cardiovascular system. And in certain cases, excess of pituitary hormones like ACTH that can also cause dyslipidemia, as we see in the Cushing disease. Weight gain can be a common problem in patients with pituitary conditions. The best, with the damage of only the pituitary gland cannot explain the severe obesity. So, but the pituitary tumor like Cushing disease, which is due to the autonomous production of the ACTH, can result in central obesity, increase in blood pressure, and can lead to type 2 diabetes.
Right. Dr. Chitra, are there other conditions other than tumors that affect the pituitary gland?
Yes, there are many. Ones are these. During the development of the pituitary, for some reason the pituitary gland is not functioning properly. Then children will usually present with short stature, not being able to grow tall, not being able to have proper development, or not being able to be speak properly. All of these could be because of thyroid hormone deficiency and growth hormone deficiency. Another condition which is common of pituitary, which is the tumor, is what is called hypophysitis. It is an infection of the pituitary gland, inflammation of the pituitary gland. This can occur usually in association with some conditions in our country like tuberculosis. Another important form of pituitary syndrome. This is seen usually in mothers who just delivered. They present with not being able to breastfeed the child, and they also might notice giddiness, extreme tiredness. So, if a newborn child and the mother is not able to feed the child, this is a condition to keep in mind and to speak to a gynecologist about it.
All right, Dr. Sharma, can pituitary issues cause heart problems?
Yes, definitely, because as we already discussed, many increase or decrease in the hormone can lead to changes in our lipid profile. Our cholesterol and lipid is directly related to how well our heart is, right? So increase in cholesterol can cause effect on our heart. Similarly, an increase in hormones such as growth hormone is associated with other cardiac illness, that is cardiomegaly. There is increase in the muscle thickness of your heart, and cardiac failure can also. A condition in which there is an increase in the cortisol in our body due to ACTH production from the pituitary hormone is known as the Cushing's disease. Now, in this disease, there are multiple factors that can lead to a cardiovascular risk. These include increase in your weight gain, and there is a tendency for the blood to coagulate easily, thus causing an increased risk of a coronary artery disease or a pulmonary embolism. Similarly, a reduction in hormones such as most well known is the hypothyroidism. Then a reduction in sex hormone, that is hypogonadism, are also associated with an increased risk of cardiovascular diseases in our body, as there is a reduced metabolism because of these disorders.
All right, Dr. Tejaswi, how does the pituitary glands affect the reproductive system?
Pituitary gland plays an important role in the regulation of reproduction. Gonadotropins, that is the LH and FSH, which is secreted from the pituitary, stimulates the production of the sexual hormones, which is important for the vitality of a person. And LH, FSH plays an important role in the ovarian follicle development and also in a process of ovulation. And FSH, especially in males, are helpful in the spermatogenesis. And similarly, excess of pituitary means disorders of the pituitary gland, like in prolactinoma, that also decreases the sexual hormones, in turn resulting into the hypogonadism. And TSH deficiency also result in the menstrual irregularities in female, and they can also have one of the cause for the male and the female infertility. So this way the pituitary gland can affect the reproductive system.
Right, Dr. Chitra, if you could finally tell us, what are the symptoms of hormone imbalance?
Right. So I think this is everybody's favorite word to understand hormone balance. With respect to the pituitary, as has been discussed by Dr. Chitra and Dr. Himanshu, there can be two ends of the spectrum. One where the hormone levels are high, one where the hormones level are low. When it comes to the pituitary, conditions where the hormone levels are high are a few, like Cushing's disease, like acromegaly, where hormone levels are high, or prolactinoma, where prolactin levels are high. These are all functioning tumors where they produce hormones. A good percentage of pituitary tumors can be non-functioning, where they might be enlarged, they don't produce any particular hormone in excess. The other end of the spectrum is where this enlarged tumor compresses the normal functioning pituitary gland in the surrounding, reduces the hormone levels which are produced from signals from the pituitary. So those symptoms can present as not having periods, women having discharge from their breast, and in men it can present as loss of libido, erectile dysfunction, blood pressure being low, also
Right.
certain electrolytes, especially sodium being low.
All right. Well, thank you so much, doctors, for joining us on the program and answering all those questions and raising awareness about this very important issue. With that, we'll slip into a short break. Thanks for watching.